For those of you that I haven't met at this point, my name is Leah Brandt, and I am the co-director at the Center for Health Ethics here at the University of Missouri. And it's my pleasure to introduce our next speaker. This will be our last speaker of the day. And this is Dr. Tammy Gurley-Calvez, and she received her PhD and master's degree in economics from the University of Tennessee, Knoxville, and a BA in economics and political science from the University of Colorado Boulder. Prior to joining the University of Kansas faculty in 2012, some of you may know I went to the University of Kansas, so I don't always admit to that sometimes, but thank you. Dr. Gurley-Calvez was a research assistant professor at West Virginia University, and prior to that, senior economist at the U.S. Government Accountability Office. She specializes in policy research using large databases, including Medicaid claims data, controlled substance data, and tax return data. In the Department of Health Policy and Management, Dr. Gurley-Calvez teaches statistical applications using large databases and modeling in health services research. Dr. Gurley-Calvez's research interests include health economics, health policy, including impacts of ACA reforms and Medicaid reforms, entrepreneurship, and tax policy. So please join me in welcoming Dr. Gurley-Calvez.
I'm sure you're all very disappointed that they didn't ask me to talk about regression discontinuity and differences today. All right, so we'll leave the statistics behind for now, and I'm going to talk to you about marketplaces, which are related to two of my major research streams. So the first one, and after that introduction, it's not going to seem so random that I'm going to talk about West Virginia a little bit, but I spent 5 years in that state, and I'm currently working on a 5-year project to evaluate their health benefit marketplace, which I'm glad they gave us 5 years. And the other project, I'm in Kansas City, Kansas, but about as close to Missouri as you can get and still be in Kansas at the medical school. And I've been working with the Healthcare Foundation of Greater Kansas City. They did a large consumer outreach effort. So I'm going to give you a little bit of consumer perspective about the ACA marketplaces. But before I dive in, and these numbers are inexact, so think of them as big picture numbers and not exactly precise estimates. I want to give you a little bit of an idea about how many people we're talking about on the exchanges. So you saw the number earlier today in the first keynote of 7.3 million enrolled in the exchanges. And I'm not supposed to say exchanges anymore, we're supposed to call them marketplaces, but I will probably use those terms interchangeably. Of those 7.3 million, not all of them are newly insured. In fact, most of them already had insurance from somewhere else. So about 2 million of them are newly insured. Okay? So in total, we have about 13 million newly insured people after ACA implementation, or 2014. I know some of it started in 2010, but after 2014, we have about 13 million newly insured people, of which 2 million are coming through the exchange. So where are all the other people coming from? Is it Medicaid? 4 million people newly insured through Medicaid. So where's this big bump coming from? Where are the other 7 million? Employer-provided insurance. So it's just interesting to me, and there have been some dire predictions. My advisor's advisor, I don't know if I should admit this publicly, is Doug Holtz-Eakin, and so he's pretty big on the national political stage, and he has a quote out there in the media as saying that that employer-provided insurance was going to drop drastically, like 50%. It may happen, but it hasn't happened yet. So the dire predictions haven't come through. The other predictions were that it was going to drop slightly. It didn't even do that. It increased. And it's where our biggest bump in insurance came from. So in terms of talking about the marketplaces, it's part of the picture, but just part of the picture. Maybe more of the picture going forward. So just kind of a general overview of what I plan on talking about today. Oh, and I do want to mention, I know it's late in the day, and thank you for sticking in there. I would love to take questions along the way. So if questions pop up and you want to talk about something along the way, then I'd prefer to have more of a conversation. First, we're just going to talk about what is a marketplace, how state choices about marketplaces are going to lead to different experiences for consumers in different states. I want to talk to you about the marketplace population, because this is something that was not abundantly clear to me when I first started thinking about marketplaces. Who's on there? Who's buying insurance through the marketplaces? I want to talk a little bit, now we're really digging into the weeds. Economists do that a lot, I guess. But I want to talk some specifics about how premiums are calculated and how the subsidies work. And so we get an idea of kind of how complicated these moving parts are and how they work together, and how consumers have to navigate these things to make a decision. I'm going to talk a little bit about the plans that are on the marketplace, give you some examples, how the Medicaid gap kind of interacts with this whole marketplace exchange experience, and then I want to talk about some of the consumer experiences. So what is a health benefit marketplace? And if you remember, if you read in the early days, it was the exchange. Now it's the marketplace. Exchange got a lot of negative connotations, so now we're supposed to call them the marketplaces. It is an online tool, right? Healthcare.gov. It's your portal for application for plans. So you have to sign up for an account, and then you apply, and at that time you find out whether you're qualified for a subsidy or not. You can view the available marketplace plans, and I think at its conception, people saw the marketplace being a real decision-making tool. So help me decide which plan is most appropriate for me. In reality and implementation, I don't think it has been that. Largely, if you're getting decision-making help, it's happening through the navigators or the certified application counselors. The marketplace is also the only place you can access federal subsidies. So why would someone shop on the marketplace instead of going directly to Blue Cross and Blue Shield? It's the only place you can get subsidies from the federal government. If you are not subsidy eligible, then I think there are reasons you probably wouldn't shop on the marketplace. Not the least of which, when you do apply for an account on the marketplace, your information goes out to 7 different federal agencies, including the IRS and Homeland Security. And as someone who spent years of my life trying to get access to IRS tax return data, this is unprecedented sharing of data across federal agencies. So here's a little picture about how it works. You sign up for an account. You apply. To apply, you have to have a good bit of information. You have to have information about all your dependents, your income. Then you look at the available plans, and you select a plan and enroll. And something that I want to point out about in the marketplace is it is not a pay here kind of experience, especially in the federal marketplaces like Kansas and Missouri have. So you enroll in your plan, and then you're going to get a separate communication from the insurance provider, the carrier, to actually make your payments. And so that's why you see this distinction between people who enroll and people who actually made their premium payment. And it is my understanding that you oftentimes have to make your payments every month. So it is possible that you enroll and make the first payment, but don't make the 4th or 5th payment, depending on what's going on in your life. So enrollment not necessarily equal to coverage in every case. So thinking about this as an economist and consumer behavior, how might this tool change the way people behave? Well, it might decrease the costs of obtaining information. When I was in West Virginia, we were having our 3rd son, and I thought, I need help. So I was looking into hiring a nanny, and I thought, if I'm going to buy insurance for her, I have no idea where to look. And so I ended up using Google to try to figure out where I could look for insurance plans for her. At least now you know a place you can go. So it is kind of a central entry point into shopping for health insurance. It might increase transparency among plans. I'm going to show you some examples from the website, and so you can decide just how much transparency is added by using the marketplace. But I want to talk about some of the limitations too, because insurance carriers, all of their new plans have to meet ACA requirements, but they do not have to participate in the exchange. And many actually large carriers do not participate in this exchange. In West Virginia, for instance, there was one option, Blue Cross and Blue Shield. The only provider on the exchanging in the Kansas City area, we've got Blue Cross, Blue Shield, and Coventry. They may offer multiple plans, but in the end, there are only 2 carriers. There's a lot of presentations today. There's considerable uncertainty. The kind of top-level information that you use to select the plan may hide some other information that's important to you. For instance, it's not that you can't find it, but you have to dig very deep. What drugs are covered? Who's included in the provider network? How is mental health covered in this plan? So there's still a bit of uncertainty, even if you're looking at the plan on the exchange. We'll talk about this. I started life as a tax economist, so I have to talk about taxes a little bit. But there could be some implications for your activity on the marketplace on your tax return. And of course, we all, I'm sure, have heard about the problems that federal IT had in terms of implementing the marketplace. It didn't go smoothly. So what's available on the marketplace? There are different plan tiers. And I don't have catastrophic down here, but if you're a young person, you could conceivably buy a catastrophic plan. We saw earlier today a slide said 2% of people are actually choosing that plan. You have bronze, silver, gold, and we should just cross out platinum right now because very few exchanges actually have a platinum option. And actually, there are very few gold options, too. And so we talked about how most people are choosing silver, but that's really where most of the action is. You have very few choices in these other plans. So 70% of actuarial value. That means as the consumer, you're expected to pay 30% of expected health expenditures that the actuaries have calculated. By my best guess, this is somewhere around $8,000. Expected expenditures are somewhere around $8,000. And that doesn't count premiums, okay? So how do you pay your portion, this 30%? You pay it through, it doesn't count premiums, you pay it through deductibles, co-pays, and co-insurance. Okay, we'll get back to plan specifics a little bit more in a little bit more detail in a little while. But let's talk about the population. So who's on the exchange? These are adults. 96% are adults. And 2/3 of them are age 35 or greater, and I really wish that I had changed the slide a little bit. It's actually age 35 to 64, right? Because once you hit 65, you're technically eligible for Medicare and you're not on the exchange. So we have 2/3 of people who are between the ages of 35 and 64, and so I believe that that means that that particular age group is overrepresented on the exchanges. Yes?
Okay, 96% age 18% or greater. The 4% who are less than 18 would be covered by parents' plans? Or are you saying a 16-year-old who's like an emancipated minor can sign up on their own?
I technically don't know if that's possible. I think where the 4% is coming in is that these are households that don't qualify for subsidies. Their kids, their income is too high, so their children don't qualify for CHIP or Medicaid, so they are actually purchasing a family plan. So this may be an entrepreneur, but these are not, I don't think these are.
Students signing up on their own when they're 16.
Yeah, I don't think so, but I haven't, actually you can't get the data at that level of detail out of federal exchanges. These are people enrolling, so I want to make this distinction too. These are the people enrolling in the exchange, not the eligible population, right? The eligible population might look different, I suspect does look quite different from the people who are actually enrolling. Most of them are qualifying for subsidies. 85% of people who are enrolling in plans in the marketplace qualify for some sort of federal subsidy. The qualification for these subsidies is a little bit different. In Missouri and Kansas, you qualify for a subsidy between 100 and 400% of the federal poverty line. In states that expanded Medicaid, it starts at 138. And I don't know, you might have heard different numbers thrown around. It's technically you qualify for Medicaid up to 133% of the federal poverty line with a 5 percentage point margin error. So effectively, it's 138% of the federal poverty line. You have to have no affordable employer option. So what do we mean by affordable? The premium has to be less than 9.5% of your income. Your portion of the premium has to be less than 9.5% of your income. You can also enroll on the exchange if your employer plan doesn't meet ACA minimum coverage standards, which this might open the door to more people than who are actually enrolling in the exchanges. Or you be someone that has no employer offer of health insurance. One thing that I want to mention here, because I think there are big groups that are kind of left out of this whole discussion, is you have to be a U.S. citizen. And so, yes, it's not true? Okay. Yes, I'm sorry, I'm not being very technical in my language here, yes. You have to be legally in the U.S.? Is that more technically correct? Yes.
Okay, so you just can't be a so-called undocumented resident, not in the country legally. You won't qualify. But if you're a citizen or you're here on some kind of visa, student visa, green card, you're here legally. Is that right?
Legally present.
So you can be a college student on some kind of
Student visa, yes.
Student visa, it's not a green card. You can sign up.
Right.
Okay, thanks.
Ooh, it's really nice to be in a room where there are people who actually know the legal details.
Excuse me, what
Yes.
if you were not Medicare eligible, but you're over 65? It happens. You see it. You can get it. Can you repeat the question?
If you're not Medicare eligible, but you're over 65,
Over 64, right?
yeah.
You get,
Yeah.
Yeah, yeah.
it's just there'd be, if you can get Medicare, there's really no reason.
Correct, correct. If you're not eligible.
Yeah, and you can't buy the marketplace plans can't be supplemental to Medicare, right? So if you do have Medicare, you're out of the marketplaces. I want to talk a little bit about state level data. This actually looks a lot like national level data. So I've got Missouri and Kansas here. In Kansas, we had about 57,000 enrollees. So my back of the envelope estimates suggest about 17,000 new Kansans had insurance because of the exchange. In Missouri, it was 152,000 enrolled, so about 45,000 people were newly covered through the exchange. Most are female, just over half, 55%. Again, we have small numbers of young folks, a lot of people over the age of 44, and again, this is 44 to 64 generally. But the one difference I want to point out between the two states, the big difference is in Kansas, 79% of people were subsidy eligible, which means that 21% of people didn't qualify for a subsidy but actually purchased a plan through the exchange. And so it makes me wonder, and this is different from the national average. Missouri is right at the national average at 85%. And of course, I'm a farmer's daughter, so I have to think about the farmers. But it makes me wonder, with all of the farming activity in Kansas, you have a lot of people a population that is largely aging, with large assets or to protect, maybe not a lot of cash flow, but generally land assets to protect, who might not be quite eligible for Medicare yet. So I think about my parents and their town jobs that they have to qualify for health insurance. Now the marketplace might free them up to actually have health insurance while they wait to be eligible for Medicare. So what were the state options? You could set up your own state-based marketplace, and that means you're in charge of everything. You do consumer assistance, you do education, you maintain the website, and you're in charge of plan management, approving the plans that go on the exchange. You can do a state-based marketplace or a state partnership marketplace, which is what West Virginia has. And largely what happened in these cases, West Virginia really wanted a state-based marketplace, but did not have the IT infrastructure or capacity in the state to generate their own state-based marketplace. So they're relying on the federal government for the IT, and then they're in charge of the other things, the consumer assistance, the education, and the plan management. This did create this had some real impacts on my life that I didn't foresee at the time. Because West Virginia wanted a state-based marketplace, they hired us to do this analysis of their state-based marketplace, and we wanted to ask a lot of really pointed questions because we wanted to figure out what was going on in the state-based marketplace. When it ended up being a federal marketplace, the federal government was not so excited about us asking all these questions about consumer satisfaction, and so senators got involved, and eventually we get to ask all of our questions about consumer experiences on the marketplace. I don't have a lot of information about that yet since it's so early in the implementation. A federally facilitated marketplace, the federal government is either in charge of everything or the state has a small carve-out where the state is in charge of plan management, which is what Kansas has. Missouri has a full federally run marketplace. I want to show you how the marketplaces are distributed across states.